Hi, everybody. My name is Christopher Archiopoli. My pronouns are he, him, his, and I want to welcome you all to the latest episode of King County Recovery Conversations. I want to thank our guests, our hosts, King County Recovery Coalition, Orbit Audio / Temple of the Trees, our amazing host Nate, and the King County Behavioral Health and Recovery Division. Today, I'm just honored to welcome Elizabeth Dahl. She's the Executive Director for the Aurora Commons for almost 11 years, celebrated her 10-year anniversary this year. And I, in my professional role working with LEAD and Purpose Dignity Action, have had the opportunity to connect with her and her staff on multiple occasions. The work that Aurora Commons is doing in the North End is just really singular. There are not there's not enough resources anywhere, but, particularly once you start getting north of central Seattle, there are fewer and fewer resources. And I would say there is nothing that compares to what Aurora Commons is doing anywhere in the North End and possibly anywhere in the city, frankly. I mean, I just think that what you're doing is so unique and so wonderful, and so many people don't know what you do. And so I could sing your praises for a little while, but I want to give you the opportunity in your own words to talk about who you are as a person and, the mission and the history of Aurora Commons, because you're going to do it better than I can. So thank you and welcome.
Thank you so much. Thank you for that introduction. My journey started with working in coffee shops downtown Seattle in my 20s and meeting folks who I could see were experiencing homelessness and building community with them in the places that I was working. So when a person I could tell was experiencing homelessness or, in substance use in downtown, when they would come into the coffee shops I was working at, I could see myself getting excited to create a space of welcome for them. Mm-hmm. And that's not really what your manager wants you to do when you're working at coffee shops downtown. So I just felt like, I always had this heart for belonging for folks that are disconnected and left out, and that I felt like no one really knew them. And so I wanted to know them. And I did a bunch of traveling and worked at coffee shops, and then started working at a nonprofit, working with youth in the Central District at the Esler Community Center, and learned about the nonprofit sector and youth development and arts and nature and that kind of a thing. And always had a heart still for just cultivating spaces of belonging for folks that didn't have spaces of belonging. And my community at the time was building the Aurora Commons, and their heart was to cultivate community and belonging to foster health and healing among our neighbors experiencing poverty and homelessness. But it was a neighborhood response to the needs in the direct community. So our founders lived right on Nesbitt Avenue and hosted a community barbecue and garden for people who were in the neighborhood. It was housed and unhoused folks coming together, learning stories and building relationships. And through those relationships, we learned that some of the barriers that people were facing were actually pretty small, and we could help them by pooling resources to overcome their different barriers. And that was through a church called Awake Church. But the community itself was, you didn't have to listen to a sermon in order to be served. It was this beautiful, just sharing a meal and learning stories and remembering birthdays and pooling resources and sending people home and, driving people to places of recovery. So my journey started with sort of learning about the nonprofit sector and getting a certificate in nonprofit management at the time. And then I was one of the first staff at the Commons. So I was there in 2000. I was a host for open mic night, actually.
Oh, fun.
My little ukulele. And one of our friends who was in recovery there with the AA hall, he was we were best buddies, me and Sam, playing at the open mic night. But I became one of the first staff in 2012. So there's just 3 of us at the time. And yeah, we've built I've learned a lot, obviously, from, I'm not in recovery myself, but I've been in the community for 15 years almost, and learned from our community. I think that's one thing Aurora Commons tries, we do very intentionally is listen. listen and respond to what people are saying that their needs are. And so all of the programming and everything that we've grown into and offered is just through us really being coming to the community with a posture of curiosity and humility to not feel like we have all the answers, to listen and to respond to what people's stated needs are. And I think that has built this, while we've added a lot of things over the years with different clinics that we have on site and resources. We try to, provide resources to remove the barrier of folks constantly needing to access basic needs. So we provide many basic needs so that people can make connections towards next steps and make progress in whatever it is that they're wanting to make progress in. But our heartbeat is always this shared space of belonging, of like, you don't actually need to have anything on your chart in order to be welcome here. Come in, have a cup of coffee. How are you doing? It's nice to see you. That starts that builds trust, and in building trust through welcoming spaces of belonging, people can take a breath, and then when they're ready, we have an advocacy team they can connect to, usually same day if they're there early enough, and start making progress towards whatever it is that they're working on, or they can just come in and have food and be known. And I think that's one of the things that I loved from the very beginning of Aurora Commons that was my burden for folks, is just that they have a place where they are not kicked out of right away, that everyone has a place to belong and to be known and to just, this third space that a lot of folks don't have access to when they don't have a home. And so that was what I was drawn to originally, is this mission of belonging. And then through there, we've built this sweet little amazing nonprofit. I guess it's not so little anymore, but 15 years later, we're, serving about 250 people a day. We first started, it was, maybe 20.
Yeah, I mean, you sort of alluded to some of the things that you do there. One, I've been in your space. It's beautiful. It's very comfortable. I mean, sometimes when you go into places that serve our unhoused community, it feels that way. Excuse me. It feels like a space that is other. And I think what always strikes me, pardon me. Sorry.
It's okay.
What always strikes me when I'm in your space is how it is designed to make people feel welcome. And that is not just for unhoused people. Like when I walk in there, like I'm always struck by like the spaces that are designed for connection and for community, and the games and the couches, and it's just very welcoming. So there's that and my own impression, but wondering if you can speak a little bit more about like the services that you do provide for folks, because I know there's meals and case management, but I think there's more than I even know.
Yeah, I'd be happy to. Yeah, I think that's one thing to just call out is how welcoming and comfortable it feels. It actually takes a lot of intention to create a space that's welcoming. And the reason I was telling someone this, maybe it was Julie, maybe this is what she was talking about, but I was saying, like, if you're going to throw a party and it's a themed party, you can tell when it's not been planned out. If you get like, oh, it's a pirate party, but then you just get like, the thing that you do is you get a pirate cake and everyone's like, this is kind of lame. Like you say you're throwing a pirate party and there's just like this, that's not it, right? But you're selling the idea of welcome in every detail that you offer. And so it's lighting, it's, color scheme, it's intentionality, it's offering cream instead of powdered creamer for your coffee. It's having really good coffee. We actually get our coffee from Storyville. Shout out to Storyville.
Oh, heck yeah.
It's extremely good coffee.
Good coffee,
I mean, in
yeah.
Seattle, that would be pretty sacrilegious if we didn't offer good coffee. And so I think there's a deep intention and cultivating space of welcome even before someone is spoken to. That does a lot of selling not like we're selling anything, but like of telling folks that the welcome, they start to feel welcome even before they're spoken to. And there's a lot of intention and thought behind that. So the resources that we have, many basic needs. So food, clothing, hygiene, restrooms, laundry, hygiene, including things like shampoo and clippers. And often we try to have, undergarments and socks and wound care, things like that. We do serve a hot meal every day. We typically, run out about noon, but we just serve until we don't have any left. It's about 200 meals that go out a day. We serve about 250 people, so some folks don't get food. We try to have extra stuff on hand for folks that don't get the hot meal. And then other resources are when folks come in and they get, food and water and hygiene, basic needs met, they're able to also connect with our other resources, which are things like our advocacy team. We do through years of learning about, the population that we're serving, that, there's not always a way to charge your phone, or maybe your phone got stolen, you don't know what day or time it is. It's hard to keep appointments when you're in survival mode. And so we've created a model of advocacy that is really low barrier, that people can typically access, at least sign up for advocacy the same day and talk to somebody, as long as they're there within that window. The list, I get an alert. We have a Slack channel. I get an alert every day of when that list closes, when it's full for the day, and it's been closing earlier and earlier every single week for the last, couple of years. So we used to close the list at 12:30, then it started to be at 12, and then it was at 11:30, and I think last week or the week before we closed the list at 10:45. So it means the list was only open for 45 minutes before it was completely full for the day. So there's definitely a need, an unmet need in our community for more support. And then the other amazing partnership that we formed was with UW Harborview Madison Clinic, and in 2018 we opened the She Clinic. So that is a fairly comprehensive women's healthcare clinic. And then in 2021, I believe it was, we opened the Aurora Clinic. So the She Clinic is for female patients, space for women to come and get healthcare in a space that's for them. And then the Aurora Clinic, also through partnership with UW Harborview, is a clinic that's for everyone. So that's on site. We were able to build that out during the pandemic, which is amazing. 2021, we built those spaces on site, the clinic rooms and the waiting room.
Yeah, it's an amazing space, especially for people, because Central Seattle doesn't feel that far away to some of us, but from where you all are located, that's a 40-minute bus ride.
Yes.
On the E-line, it's a lot of work to get sort of downtown. So having access to medical care in where people are living, I think is really important. And I do think that, that I was having a conversation with Dr. Dombrowski a few weeks ago about you. I told her that I was going to be interviewing you, and she's like, ask this question. And I forgot the question. But I think that was what she was talking about, was about the importance of service design, because that was sort of adjacent to what her and I were talking about. There's a lot of intentionality that goes into, thinking about like any sort of, like a retail environment and creating a customer experience.
Yes.
And that's really what you're doing there too, is creating a customer experience.
Exactly. I like to say that, and we were trying to think about how do you teach the gift of hospitality for folks that maybe don't naturally have it? And I started to just sort of like ponder on this, like what is hospitality in these spaces? And I was just pondering on this, and I was thinking, okay, the Commons is like a bar at 2 a.m., a really fast-paced coffee shop, and I want it to feel like the Ritz-Carlton. Like excellent customer service. Nobody, like, there's this whole like philosophy that I started getting into, like the Ritz-Carlton and how do they do customer service, and it's actually based on this. I could go into this forever. We could do a podcast just about scenography, but it's essentially cultivating the encounters for people in a way that makes them feel cared for, no matter what resource they're accessing, and just thoughtful intention around, like, if people are waiting a really long time and they're getting stressed, maybe someone goes out there with a cup of coffee. Right. And so thinking about each scene that people encounter and how can we continue to cultivate belonging in those spaces. Super interesting, but yeah.
Well, I mean, that's a lot of, I mean, it seems odd to think about, like the analogs of like the Ritz-Carlton or the Four Seasons when we're talking about, taking care of our in-house community. Like, I can't afford to go to the Four Seasons or the Ritz. But, I think, this is something that I'm really interested in as well, which is like taking the lessons of business and applying them to what we do in nonprofit. My educational background is all in marketing and business. And so, thinking about and I used to work in salons for a long time. So I think a lot about like, how do we take those lessons of creating an impeccable customer service experience and translating it to taking care of the populations that we're looking after.
Right, because it translates to belonging, and belonging heals.
Absolutely.
And belonging, this is what we like to say at the Commons, is that belonging lasts longer than a roof. Mm-hmm. So that means that when you're in these spaces of belonging, you begin to heal. And healing is what lasts longer than a roof. So like what I mean is, like, let's say that folks get housing and they're disconnected and they're alone and things like that. Like they're not able to heal in isolation in that sense. And so one thing I love about our model is that belonging heals, like community heals. And when folks get connected to those resources and they start to build trust through excellent customer service, through welcome, and through trust, people are able to start to build a foundation of confidence to make next steps. Mm-hmm. And that then begin to heal from the trauma of the streets, from the trauma of whatever it is that they're going through. And that has a lasting effect.
Absolutely. And I think, you're touching on something that I think is really important is we all just want to feel welcome somewhere. We all just want to belong somewhere. And, I thankfully was never unhoused, but I experienced housing instability during my addiction. And, when you're living in that state, there's a lot of places you're not welcome. Mm-hmm. There's a lot of places where you don't belong. Mm-hmm. And you're constantly trying to gauge, like, what door am I allowed to walk through? Mm-hmm. And where am I going to feel the least amount of friction? Yeah. And to find a place where there is no friction is pretty rare. Yeah. Even in medical environments. I mean, I think that's one of the beauties of like the Aurora Clinic and the She Clinic and Madison Clinic and Max Clinic is they've done that. Mm-hmm. But going to the ED, going into even many social service environments. Yeah. So for you to have built something where people feel welcome and belong, I think is just really a beautiful thing. Yeah. And tell me, I mean, I know that you refer to the people that come to the Commons as neighbors. Mm-hmm. Can you tell me, I think it's 100% appropriate and the best use of that word, but can you tell me how you all landed on that and like where that came from? Because I think it speaks to the intentionality that you were talking about earlier. Mm-hmm.
It directly came from, and actually it links back to our founding. And that is that, and this is connected to faith-based principles, but there was a sermon at one of our supporters, Bethany Community Church, and the pastor said, "Who is your neighbor?" And they were talking about our neighbors, just folks that look like you, that live directly next to you in a house, or neighbors. Like, how can we, like, who are the people that live around you? And some of our founders really sat with that and thought and just really dug into who are our neighbors, and our neighbors just the folks that are living in the houses around us. We're living right up the street from folks who call a hotel or motel their home, that don't have an apartment, or folks that are living in their vehicles, or folks that are living unsheltered. And so that's what it was rooted in, is just who are our neighbors. And if the call among the faith community is to love your neighbor as yourself, how do we do that? And who are those people that are our neighbors? And so that's really where it started with us looking at our community. We we don't want folks to feel like they're clients. We don't want people to feel like they have to have certain diagnosis in order to be seen, or how long have you been experiencing homelessness in order to get different resources. We wanted folks to feel like we were removing the barrier of us and them and creating neutral space of welcome for folks to be co-impacted by one another. Because that was another thing that we knew early on, was that this is not just a place for people experiencing homelessness and housing instability and substance use. It's not just a place for them to find belonging. We all found belonging in these spaces, and we're impacted equally by the folks who are accessing services through community and through just these transformational experiences of being impacted by their wisdom and humor and kindness and perspective on the world. And so I think that, who is your neighbor? We have a lot of folks that don't want to recognize certain folks as their neighbor. Mm-hmm. And our response to that was, we're not only just going to we don't want to just know who our neighbor is, but we want to see who they are and welcome them in and build community. And in the beginning, we thought, this is a space for the community. This is a third space, not just for housed folks or for unhoused folks to come. This is a space where we wanted housed neighbors to come in and share life in this like beautiful, messy, funny space, neighborhood living room of the Commons. Yeah. And as the need has grown, there are fewer and fewer housed folks that hang out around the Commons. We have lots of awesome volunteers and things, but the intention is for this to be almost like a community center, but an actual neighborhood living room for people to access.
Well, and I think that's again something really special that you all have done is, this could be a pain point in the neighborhood potentially. I mean, you are, like I said, one of the very few resources in North Seattle. Mm-hmm. You're located right off of Aurora, where there are a lot of challenges. Mm-hmm. And what has struck me in having conversations with people that live up there is how supportive people are of the services you provide. Like, I don't get the NIMBY energy from people that live up there that we sometimes see in other places. Mm-hmm. And so I'm wondering, and again, like, just going to keep going to this word that you used, intentionality, like that didn't happen by accident. Mm-hmm. Like that had to have been some work. Because, I do hear a lot of NIMBY stuff when I talk to people up there, but you are not one of the things that people complain about. So I'm curious how you built that.
I'm like going back through, my eyes twitching a little bit, thinking about
sure
some of these.
It was a lot of work.
Oh,
I bet there were some conversations.
Unbelievable amounts of work. Yeah. I think that oftentimes when we've had a lot of seasons where there's a lot of people that are mad at what we're doing.
Yeah.
And I find that sometimes the difference between someone who is mad at us or like not a fan of the work that we're doing and turns into kind of an advocate is education, mm-hmm. is information. When I have like authentic conversations with people, and I'm like, once people find out, we've been in the neighborhood a lot longer, sometimes a lot longer than some of the folks that moved in after we've been there. When they find out that we were neighbors that responded to the needs in this community, like that helps for people to understand we saw the needs here and this is how we responded to it. Sometimes that kind of helps people to understand, like, okay, like maybe you were here longer than us, or if you actually were literally housed on this block, that kind of changes the conversation sometimes, that we're not just, this probably is going to shock people, but there's a lot of seasons when it was a lot worse out there than it is now. Mm-hmm. But I will say that, oh man, countless community meetings, conversations, business, like I've been a part of different business groups in the neighborhood, and I try to come at all community engagement with a posture of curiosity and humility. Like I understand why people think that we're a draw for the neighborhood. I also know that like there's a lot less evening activity once folks who had evening hours moved out of the neighborhood and were open, all the time. I know that, we selected this area not just selected, but we built community in this area because that's where our founders were living. And it was also like we want to know who these folks are that are living in this like stretch of Aurora, because Aurora is broken up into a bunch of different zip codes. It's not, but for folks that live or that are living unsheltered or in hotels and motels, Aurora is like north-south. It doesn't go too far off, on either side of Aurora. And so that was like, that was where our community wanted to build this intentional community. So I think lots and lots of different engagements with local churches and community groups, businesses, asking people, like doing things like community cleanups, responding to, we have a partnership, well, not partnership, but we have, connection to the local schools. What are some of the pinch points? How can we support as good neighbor, as folks who want to be good neighbors? How can we support some of these pinch points in the community? That's 15 years of intentional community building. There's still a lot of folks that don't necessarily like everything that we're doing. But I go to a lot of community meetings, and, I went to one, and this one lady across the street, she works at one of the businesses across the street. She asked in a community meeting, "What is that, a meth clinic over there?" And I like raised my hand, and I was like, "I can take that one." And so I just chatted with her, and I was like, "This is what we're doing." It was like a meth clinic. Maybe you mean methadone? I don't know.
Yeah.
And so I just explained to her what we were doing and how people are finding hope and healing and connection. And it's not just this like cute little, sweet, nice message of, oh, we love our neighbors as ourselves, and that's the end of the story. Like there is a tremendous amount of data that we've collected over the years that shows that people, when they can heal, they get to be, they have the confidence to make these next steps and to reintegrate it back into the community and to feel worthy of it, in a lot of ways. And not saying that they didn't have worth before, but it's just you when you're on the outside of society for so long, there's work that needs to happen in order to start to see your own worth sometimes. And so she was like, "What is that, a meth clinic?" And I was like, "I can take that." And so I talked with her, and then she was like, "What are you guys even doing over there?" And I was like, "This," and she was like, Can I come see?" And I was like, "Yeah, come on down." Over. And so she came down, and she was like, "Do you guys need like socks?" And I was like, "Yeah." And so it was like, went from this, like, what the hell are you people doing, to, can I bring you guys socks? And so I think that like, I try to not, I used to be a lot more bristly in my early days of this work and just being like trying to fight for like the rights of people that are, and I still feel like that's my core of who I am, is like, don't talk about people like that. Don't use those terms in polite conversation. Like people still think it's okay to use derogatory terms about this population and just like casual conversations. And so I'm like, I used to get mad and now I get even. No, just kidding. Now I feel like I just have more grace, and I'm like, it often is people just don't know. And I don't think that people are necessarily, they don't dislike places like the Commons because they are bad people. They just, a lot of folks don't understand. And I think that there's opportunities for us to share, what we're doing, the intention, the success of our model and things that we're working on, and also like helping people to face their own stigma about things. There's a lot. I mean, I'm sure you wouldn't be surprised, but it's unbelievable some of the things that people think people have access to. Like as far as like, even I was talking with Luke earlier. Luke is our director of programs, and I was like, "What's the average still of that it takes to get someone into treatment right now?" And he's like, "Well, if we're working with someone, really closely and they don't disappear, a month." And I was like, so that's like
is an enormous amount of time.
That's so much time, because when people are ready to make the change, like let's say that they're using substances and they're like, "I'm ready to like make this change in my life." How often can we say, "Okay, we're ready too, and we're ready to do something now when you're ready"? Because if we don't respond right away when someone says that they're ready, when they're at rock bottom, and we can tell they're at rock bottom, we we don't have the resources to be able to connect them right away with the resources that they're asking for. And that's like, housing and treatment often. And so I think once people learn some of those realities, they're like, can't people just get into whatever resource they want right away? And it's like, absolutely not, and some folks that we've had on housing lists for 5 years.
Right.
And some folks we've been trying to get into treatment and they keep disappearing. They're in survival mode. And some people, are ready to hit rock bottom. We can't get them into treatment. And then we never see them again because they overdose and die. Right. And that reality is it's real and it's painful. And I think that, in a kind way, offering information to folks who maybe were a NIMBY who aren't a NIMBY anymore, sometimes that can help. And sometimes people just want to be mad and then there's nothing you can do about that. But
yeah, they're very difficult conversations, but I do find that there's a little bit more room in those conversations than there are in some other topics. Like, I'm never going to talk somebody out of their political position.
Right.
But I do find that if I can, because I'm a little bristly as well, and I think it's required to be in this work, frankly.
Sure.
I don't think if you don't have a little bit of a tough skin and be willing to fight and push back, you're not going to make it.
Right.
Because we're also advocates for these people who
Yes.
don't have voices.
Yes.
Like, people don't listen to our unhoused neighbors. They don't listen to people in substance use. So we have to be the voices for them in those rooms. So there has to be some of that. But it's a weird balance because you also have to be willing to step back and listen sometimes.
Yeah.
So that you can have that conversation.
Mm-hmm.
And I agree 100% that if you can educate people and they're willing to listen, they also have to be willing to listen. It's a two-way street. I have seen people shift their position when it comes to the work that we do.
I have, yes.
It's not, and that's a weird thing because especially in the way that our society is right now, where everything is a fight.
Yeah, there are more wins than you would think.
Right.
When you give people information, it's not just all about giving people information and they'll change their mind. It's also about how you're giving the information.
Yeah, cannot be patronizing.
Right.
Cannot be condescending.
Right.
It's ask questions, motivational interviewing,
Yes.
blah, blah.
Exactly.
Well, there's a couple, as we're sort of running out of time, there's a couple things that I want to touch on before we run out. One is, so I know you all do something called Seattle Stories, or you're connected to Seattle Stories. I don't 100% know how you're connected, so maybe you can illuminate me on that, but there is a series called Seattle Stories that is on Instagram and YouTube. There are half-hour versions on YouTube and smaller snippets on Instagram. And I will say that as a consumer of social media, they are some of my favorite things. I watch them every time. I like them every time. I share them every time. I think they are some of the most beautiful things on social media. So however that idea came about, thank you, because it puts and if you, the listeners and watchers of this, have not seen Seattle Stories, find it, because it allows people who often are voiceless to tell their story.
Yes.
And it does it in a way that it always starts with the question of what do you want the people of Seattle to know? And then it goes from there. And I'm almost speechless about how beautiful they are. So can you tell a little bit about how that happened and where that idea came from?
Yeah.
And who does it?
Yeah. Well, I will say that I can take zero credit. The Commons can take zero credit for Seattle Stories. That is one of our friends in our community from years ago who is an amazing photographer and just in the community of folks that started the Commons and still connected with a lot of our founding friends and community. And he doesn't want to be the face of Seattle Stories, but he also, and so I'm not going to necessarily share his name right now.
Don't have to.
But this is his work, his body of work, and it's beautiful. And we're sponsoring the work because we, as an organization, I would say supporting. So we're supporting this person to to continue Seattle Stories and cultivate belonging and community in our space with our neighbors. He already had interviewed a number of them before we started to work together on this project. I will say work together. We don't do anything for Seattle Stories. This person does it all, and it's his vision and his work. And he the things that we've offered him are just are questions to think about for this population and answering any questions he might have, because he wasn't in homelessness before he started working on this. And so we actually it's a project we're hoping to continue to sponsor, if I'm perfectly honest.
Yeah.
It is we had a lot of financial hits this last year with federal funding cuts. I think we're down in cuts and had to cut out of our budget about $300,000. With a budget of about $2 million, that's a significant amount. And so we hope to continue to sponsor Seattle Stories, and all that means is we pay for a little bit of his time to continue to do it, and then he also supports us with beautiful imagery and does portrait days with our neighbors, and it's all voluntary, for folks that want to sign up to have their portrait taken. But people just absolutely love him and love doing the portraits at the Commons, and they've done, like, originally we were going to do pet portraits. That's where he came around at first, and then the neighbors wanted our neighbors wanted to have their portrait taken with their pet, and their portrait taken with their staff, and then it just became this thing where they want portraits. They want their portrait taken regularly. So Seattle Stories is a beautiful account, and we hope to continue to be able to support that work.
I certainly hope so. I mean, I have laughed, I've cried, I've had the whole range of emotions. So, like, share, and subscribe, as they say
exactly.
on all those videos.
Exactly.
Well, I had one other topic, but I'll add a follow-up question to what we just talked about. Like, with the funding cuts and with everything that's happening, how can people support the work of Aurora Commons? Is there a way for people to donate, whether it's items or money? How can people support you all to keep doing the amazing work that you're doing in the community?
Yeah, it's all of the above. Funding is pretty serious right now for what it is that we're facing this next calendar year. We haven't had to lay any staff off, which is amazing, but we have a number of vacant positions, which includes direct service staff, advocacy, and internal support, and potentially even having to not be able to sponsor stuff like the Seattle Stories going forward. So I think donating cash or connecting us with donors who have capacity, who want to sponsor things that we're doing. I think that's relationships too. We're also building our board. So folks that are connected to different circles, reaching out about potentially joining the board. It's just Elizabeth at auroracommons.org. And also, one of the most special things that we do during this time is we have our annual holiday Christmas party, and we give a gift bag. We try to give a gift bag to every single person that comes on that day. And last year was about 300 people that came through, and the gift bags have, hand warmers and scarves and hats and a gift card and things like that. And in the past, we've had, one of our local churches who's been a supporter of the Commons for a lot of years. They do about 200 bags, but that we surpassed that number. That's the amount that they have the capacity for. We surpassed that number last year by about 100 people. Wow. And so there is, I believe, a list on our website of if you want to buy items to go into those gift bags for folks, so everyone gets a gift. You can just find it on auroracommons.org. And we have an Amazon wish list for stuff to go in those bags.
Great.
And then you'll also, follow us on social media and things like that, and sign up for our newsletter. We have winter clothing drives and things like that. We always need men's clothes. We always need blankets. We always need gloves and hats and mittens and socks and things like that. So we have an Amazon wish list, but also if you reach out to our volunteer and donations coordinator, con@auroracommons.org, they can coordinate for drop off of items that are not just through Amazon. We have a donation space in our basement to be able to sort stuff like that. But yeah, so physical items, and then also time. We have some volunteer opportunities that are always up on our website, helping to make breakfast in the morning for folks, and all of those things. Yeah.
Yeah. No, however people can help.
Lots of ways to plug in.
Sounds like there's lots of ways to help. And so auroracommons.org, Elizabeth at auroracommons.org.
That's right.
Yeah, and your social media is active too. Like a lot of nonprofit social media sucks. I'm just gonna say that. Like whoever is managing your social media is
Christina.
Pretty darn good. I'm impressed. It's rare when I am impressed by social media for a nonprofit. So
oh my God, that means a lot. Thank you.
Yeah, I'm pretty picky. My partner would definitely tell you. He gets tired of hearing about it. Like, look at this. Look at this.
Yeah,
nonsense.
That means a lot. Yeah, they've been working on it. They've been working hard on it.
Yeah, please relay that. As somebody with a marketing background, I'm impressed.
Yay! So. Thanks for saying that.
So to close out, I want to highlight. I know this is public knowledge now, so I'm not like breaking news, but I know that you are stepping away from your role as executive director at Aurora Commons. Will you have gotten to 11 years, or will it be just shy of 11 years? I know
it'll be 11 years. Okay. Yeah, even if it's a day shy, I'm still calling it 11.
I think you should. I give you that. I give you that leeway.
Appreciate it.
So I briefly, and whatever you're willing and want to share, I'm curious like how that decision came about, and like where you see the Commons going, and what's next for you.
Yeah. 11 years. January 1, 2015 is when I became the ED. It was a lot of faith that they had in me at the time. It was a leap of faith to see what I would do in this position. I'm really grateful for it. The Commons is my whole world. It has been. I grew up at the Commons. I love everything about it. I love the staff. I love the community. And I've been thinking about, I had a kid and that kind of changes your priorities. And during the pandemic, I was one of those people that bought a house with some land a little bit farther outside the city, and that has some stuff to do with that has an impact on how well I can support the work, and I think it's just one of my mentors and good friend, Deborah Juarez. She's council member, Baghdad council member, but we've met when she was first the council member 10 years ago or something, and she says lead to leave. That was something that they, in the Native community, that's something that they teach in the community. That's something she's instilled in me. And so I think that I also understand the life cycle of a nonprofit. And at about 15 years, it's time to start to reinvent and start to sort of reevaluate what you're doing and reinvent the organization and do another. There's no amount of times that you can look at your organization at those critical moments and recalibrate, I should say. And I think that we're at a season of recalibrating. We own our property. That was something that I was really proud to be able to spearhead, of buying the whole property. So they're established in our space. We have different spaces that we're moving into. We just moved our whole admin team on site, which is really exciting. And we're in this season of like, okay, we're ready to like recalibrate and do another run of what this can look like. And I was thinking, I was just really evaluating, like, do I have another of what I just would help to cultivate another 10 years of this to do it well. And I feel I'm ready to pass the baton. To pass the baton. I don't necessarily have something I'm moving into. I just feel like a knowing that that it's time to pass the baton, and I'm trying to be. I don't want to get to a point where I'm like, people are like, "Gee, she's been here like 15 years. Maybe we can just like get out, ready for new leadership. Put her on an iceberg and just see what happens." Yeah. So I'm trying to like be realistic with how much I can offer in this next season, and also know that like when I look around, like the leadership team and the staff and the community that supports the Commons, like it's not dependent on me. The Commons is not me, you know, the Commons is this amazing, like beautiful community space of people that really, really care. And yeah, then they're also ready for this, like a season of growth. You know, the the community needs the Commons, and the lessons that we've learned there. So I'm not like disappearing. I think that the perspective I've had and the things that we've learned at 15 years on Aurora Avenue in North Seattle, during some of the most intense times in our city's like history with, you know, COVID and regime changes and all of those things. That's a rich perspective that I'm not going to just take up to Arlington with me and, you know, disappear into like, you know, like building community with my chickens or, you know, making sourdough. So I feel like I will be involved in some way in the community and offering my perspective if it's helpful. But also like the Commons is in a really good place, even though we've had these funding hits. I just presented a balanced budget.
What?
Do you
want to run for president?
Yeah, absolutely have no interest in anything that has to do with politics. So yeah, but I'm ready for the next season, and I don't know exactly what that looks like. It will probably be some time of just like staring at a wall for a while and, you know, rehearsing, looking back at the last 10 years and kind of like healing. I think healing. It's been a lot. It's been a lot to go through what we've gone through the last 10 years of 3 staff to 20, of $120,000 a year to $2 million, like buying a building, having a kid, going through COVID. I mean, that is like
a lot.
I want to
That's only the last few years.
Yeah. I want to sleep for a while. I want to sleep for a little while and just like take a breath.
Yeah, you deserve that.
Oh, thank you.
But you don't strike me as somebody who just goes quietly into the night. So I'm excited to see whatever your next chapter is when you're ready for it.
Thank you.
But you deserve a break.
Thank you.
So, well, Elizabeth, thank you so much for being here. Thank you for sharing your own story, the story of the Commons. Thank you for the work that you've built. And I agree with you. You've built an amazing team. So I have no doubt that they will take the baton and run with it.
Yes.
And the torch and whatever metaphor you want to use. I'm not at all worried that the Commons will continue to make a huge impact in the community. And look forward to continuing to partner with them.
Cool. Thank you so much for having me.
Yeah, thank you.
And the work that you do, Christopher. You're an amazing advocate for the community and you do incredible work. So thank you.
It's about you, not me.
Stop it. Stop.
But thank you. I appreciate that.
Absolutely.
I think we have a lot in common. It's hard for me to look away.
Absolutely.
Well, thank you, Elizabeth. Thank you, everybody who watched and listened today. Thank you to Orbit Audio, Temple of the Trees, Nate, King County Recovery Coalition, and King County Behavioral Health and Recovery Division. It's a lot of thank yous, but there's plenty to go around in this time. Thank you so much, and we will see you next time. Find your joy.